Welcome to the University of California Coming of Age lecture series presented by the Academic Geriatric Resource Centers at the University of California, Davis and University of California, San Diego campus. My name is Carol Howell, and it is my privilege to introduce today's speaker, Dr. Huey Lin, whose presentation is entitled Preventing Falls. Dr. Lin is a family medicine physician and geriatrician at the University of California, Davis Medical Center. He completed his medical training at Albert Einstein College of Medicine in the Bronx and residency and geriatric fellowship at Swedish Medical Center in Seattle. Dr. Lin directs a falls assessment geriatric clinic here at University of California, Davis Medical Center. Dr. Lin, welcome and thank you for being with us today.
Thank you, Carol. Well, thank you. Before we get started, I think what we really should be doing is talking about why do we need to prevent falls. Well, it's because they are one of the most serious health concerns facing persons as they age. And in the United States, the fifth leading cause of death in persons over age 65 is accidents. And 2/3 of these are due to accidents from falls. And as we discuss later, there's also quite a bit of substantial amount of non-death related issues that can happen that arise after a fall. So let's go and get started about how we can prevent falls. What I'd like to do in this presentation is to answer some questions that I'm going to pose to you, which are, who falls and why do physicians worry? What increases your risk for falls? What might your physician do in order to investigate your falls? And are there actions that you can take to reduce your falls? So let's start off with the first question. Who falls and why do physicians worry? Let's go over first a definition of a fall. Obviously, we know that it can mean a time of the year, as a season. We can also have what we call intentional falls, which is in this picture here, it is a picture of someone intentionally falling from a bicycle to show how to fall from that gracefully. There's also falling that can occur with skydiving. And these are the falls that we are worried about, which are the falls that happen where you trip and you fall. So the event or the falls that we are talking about are events that result in you unintentionally coming to rest on the ground or at any other lower level. So who does fall? Well, if you think about it, everyone falls. You fall, your spouse falls, your brother, your sister, your children. In fact, except for the frailest adults, it is the young that actually have a higher incidence of falls, especially if you look at young children and athletes. But physicians worry most about falls in elders because of the high susceptibility of injury that an elder can sustain after a fall. And as we also know, the older you are, the greater are your chances of sustaining an injury. So let's talk about elders in the community that fall. We know that 30 to 40% of community dwelling elders older than 65 fall each year. And about half of these individuals report having multiple falls. The incidence of actually falling also increases as you get older. And in fact, if you are older than 80, 50% of elders over 80 report having fallen. Also, about 50 to 66%, or 1/2 to 2/3 of these falls happen in or around the home. So why does your physician worry if you have a fall? Well, remember when I mentioned earlier that elders are more prone to injury? Well, about 25% of elders who fall suffer serious injuries. And these can include a hip fracture or head and brain injuries. Elders are more at risk of hip fractures because of low bone density, such as osteoporosis and decreased body fat. And you may think, oh, well, okay, if I break a hip, there's nothing wrong with that because a surgeon can just go ahead and fix it or give me an artificial hip, can't they? Well, that is true, but you have to also realize that falls tend or lend to an increase in mortality. In fact, it's been shown that 40 about 14 to 36% of elders who break their hip die within 1 year due to medical complications that have occurred either before or after the fall. Elders are also more at risk for severe head injury because of the increased fragility of the blood vessels of the brain and use of certain medications. And as you know, even your best surgeon in town can't give you a new brain. So you can imagine that the risk of falls is quite high, that the risk of death is quite high if you sustain a significant head injury from a fall. Physicians also worry about a fall because one of the tragedies that you may have heard about, either through friends or family, is about the elder that has fallen and can't get up. And when this happens, and no one finds the person in time, this can lead to serious muscle injuries. It can lead to pressure sores or ulcerations. It can lead to dehydration or pneumonia. These subsequent conditions after fall can ultimately lead to hospitalization, prolonged or permanent disability, or death. Even minor injuries can be traumatic. Most elders who fall actually are fortunate not to sustain a serious injury, but that it still plays a great toll on their psyche, and the falls affect them quite psychologically as well as emotionally. This is what we call fear of falling, and that's what happens is in these instances, what happens is that there's a decision to restrict or avoid activities because of a fear of falling or sustaining injury. So the answer to the question of who falls and why do physicians worry is that everyone falls. But adults over the age of 65 are more prone to the injury associated with the fall. Physicians are worried because of the severe injury that can occur, the prolonged hospitalizations that can occur, and also the possibility of loss of independence and functioning and death of the patient. So the next question is, what increases your risk for falls? Before we go into that, though, we really need to appreciate how hard it actually is to walk. There are so many systems in your body that need to coordinate and work together in order for us to stand upright and walk. And this is referred to as someone's gait. And we need many things in our body to work well in order to be able to walk, such as we need to be able to maintain an upright posture. You need to have good balance. You need to be able to feel well at the bottom of your feet so that when you walk, you can determine what surface you're walking on. You need to be able to have good coordination so then that you don't stagger about. You need to be able to see where you're going so you know which way you're walking or looking for any obstacles that may be in your way. And you need to have enough strength in both your legs and your arms in order to walk. And on top of this, all of these things need to happen at the same time so that the communication between all these things need to be continuous and instantaneous. We fall if there's any of these things that aren't functioning well. In fact, our balance and our gait naturally begins to decline starting in our 20s. Yes, in our 20s. And it greatly accelerates after the age of 40. So basically, I think sometimes take walking for granted given how difficult it is for us to do it. So there actually have been studies to rank what contributes the most to an elder's fall, and the leading cause of falls is fruit. No, actually, it's not fruit. The actual real reason that I brought this slide is really to demonstrate that the leading cause of falls are environmental hazards. In fact, this can be anywhere from banana peels, like in this slide here, wet floors, lifted cracks in the pavement, etc. But basically, environmental hazards cause about 1/3 of all falls that occur. The next most common cause of falls are listed down as the gait and balance disorders or weakness. This causes almost 20% of falls. This can be caused by a whole host of medical issues, including Parkinson's disease, age-associated loss in balance, or decreased activity, just to name a few. The last two major causes of falls each cause about 15% each of of the falls that happen. These are dizziness and vertigo, and specific medical conditions such as acute illness, such as, let's say for instance, a congestive heart failure exacerbation, can be due to medications, can be due to pain, alcohol use, or arthritis. When a physician reviews your medical history, there are known risk factors that will increase your risk for falls. And these are some of the things that your physician will review with you when they take your medical history. If we were to rate the top reasons of what will increase your risk for falls, they are the following. Number one, the greatest reason why individuals end up falling is because they have muscle weakness, and specifically, as you can imagine, lower extremity or leg or hip muscle weakness. And if you have this condition, it can increase your risk for falls by about 4 times. Also, having a history of falling before, an abnormal gait, or if you have a different style of the way you walk, or if you have poor balance, these 3 things increase your risk of falls by about 3 times. Other things that increase your risk for falls include having problems with your vision. That increases your risk of falls by about 2.5 times. Having problems with depression or memory increases your risk about twofold or 2 times. And finally, if you're older than 80, this increases your fall risk by about 1.5 times. So the answer to the second question is, what increases your risks for falls? The answer is that falls happen both from internal and external forces, and these things can increase risk for falls. Internally, you can have issues like weakness, balance problems, or depression. Externally, I guess you could have too many banana peels at home, but realistically, you probably have unidentified hazards in and around your home that will increase your risk for falling. The third question that we're going to try to answer is that, what might your physician do to investigate your falls? Well, a physician first starts off with taking a detailed history and physical exam, and they will try to gather as much detail as possible about the fall, such as when it happened, where it happened, what kind of assisted devices were you using? Were you using a cane or a walker? Did you have any associated symptoms with your fall? For example, did you have any dizziness, lightheadedness, shortness of breath, chest discomfort, palpitations, feeling like you're going to pass out? All these information that your physician will collect from you is very important for he or she to determine what could be causing your falls to happen. Don't be upset or flustered though if you don't remember the details, as many people don't recall the fall if it was over 3 months ago. Another thing that will also probably be done at your physician's office in a falls evaluation will include a special blood pressure testing called checking for orthostatics, or checking for orthostatic hypotension. This is a special type of measurement of both your blood pressure and your pulse that either your physician or his or her staff will do, where your blood pressure and pulse is checked while you're lying down, sitting, and then standing. What this does is it determines whether changes in your body's positioning is causing significant decline in your blood pressure. And if you have a significant decline in your blood pressure, this gives you that lightheaded, woozy, dizzy feeling. Sometimes some of you may experience this when you, let's say, have had a busy day, haven't had enough water to drink throughout the day, and then all of a sudden you have to get up from a sitting to a standing position and you feel this gray, lightheaded feeling. This is what ends up being called orthostatic hypotension. This can be caused by being dehydrated, certain medications, or certain medical conditions. It is an important component to evaluation of why you're falling. Another thing that will be very important in your evaluation that your physician will do will also include a medication review. This is also very important because there are certain medications that, although you may need it for your medical conditions, do have known side effects that can increase your risk for falls. Certain medications that increase your risk for falls include certain high blood pressure medications, anti-seizure medications, certain heart medications, and certain pain medications. It's important to review these with your physician because if these medications are causing your symptoms in terms of dizziness, lightheadedness, or in fact contributing to your falls, then there may be alternatives that can be recommended in order to treat your medical condition. Another important test that really should be done at your doctor's office is that you should be asking your doctor to do a timed get up and go test. This is a screening test for the degree of mobility, and specifically your degree of mobility. The more problems with your mobility, the increased risk you have for falling. What this test is that the doctor both looks at how you walk as well as time you on your speed. What the doctor will do is have you sit in a chair and then time you as you stand up or rise from the chair, walk about 10 feet, turn around, walk back, and sit back down. This is repeated twice, and the time is averaged. If it takes you more than 13 and a half seconds to do this task, this suggests that you may be at increased risk for falling. Another thing that your doctor may do is that in particular aspects of your history or physical that suggests a gait, a balance, a flexibility, or a strength problem, then you may be referred to a physical therapist for further evaluation and treatment. And finally, if your physician notices a specific aspect of your health that may be contributing to your falls, then he or she may ask for a consultation from a specialist. Let's say, for example, it's been noted on your evaluation that you have trouble seeing, so you may be referred to an eye doctor. If there is a need for a second opinion, your physician may refer you to a geriatrics falls consultant to give recommendations about what may be contributing to your falls. Or your physician may refer you to a local pharmacist in order for them to help review your maybe lengthy medication list in order to see whether or not any of these medications or a combination of these medications may be contributing to your falls. So to the answer to the question of what might your physicians do to investigate your falls, well, there's a variety of things that your physicians will do, including taking a good history, including doing a good physical exam, and doing further evaluation based upon what the physical exam and the history bear. If your last doctor's visit was anything like my last doctor's visit, I met my doctor while I was on the table. He introduced himself, I shook his hand, and then that's also how we closed the visit. Me on the exam table, me shaking his hand, thank you, goodbye. And so, he didn't see me enter or leave the room. So if you have a problem with falling, you really should ask your physician to examine how you walk. And so again, as I mentioned before, it's important to ask your physician to do the time get up and go test. Not only is this a very quick and easy screening test to see if your mobility is putting you at risk for falls, but it also provides your physician the opportunity to qualitatively examine how you walk. Last question is, are there actions that you can take to reduce falls? Well, if you recall, I mentioned that about 50 to 66% of all falls occur in or near the home, and about a third of these falls occur because of environmental hazards. Well, this doesn't mean that your home is an unsafe place, but what this means is that some of the common things that you're able to manage when you're younger is getting harder to do as you age. One personal example that I have in my own home is that I used to be able to tear up and down the stairs without any problem and without any need for holding onto the handrails. And now when I do that, I kind of notice that I can't go as fast as I used to going up and down the stairs. And I actually feel unsteady unless my hand is touching the handrail. And several years from now, I'm probably not going to be able to run up and down my stairwell at home unless I hold on to that handrail, or I probably just have to not run. So your home is probably safe, but there are changes that have happened to you that have made things potentially unsafe. So let us review what you can do to make your probably safe home even safer. One of the most important things really is that you have to make sure you have good lighting in each room, especially rooms or hallways that you need to go through consistently at night. Those would be night lights in the bathrooms can be helpful, night lights in the hallways to get you from your room to the bathroom. So it's very important to have good lighting in each room. Another area of good lighting that would be important would be good lighting in your stairwell. Make sure that you do not go up and down your stairs without having the light on. Don't try to do it with the lights off. Something also that's important is that the floors should be free of clutter and tripping hazards, such as throw rugs or electrical cords. If you have throw rugs that you love and you can't get rid of them, make sure that they either have an anti-slip backing, or even better yet, if you can purchase some double-sided tape at your local hardware store and tape it down so that the edges don't lift up when you try to walk over them, because it's typically the edges that catches your toes when you try to walk over these carpets and rugs. Also, if you have cords that need to run across a certain way and you can't move the cord, then tape the cord down, preferably with a strong tape like duct tape, or even better would be to avoid the cord altogether. Make sure that at your home, if you don't already have these, that handrails are installed next to stairwells, as well as having appropriate lighting at the stairs. Make sure that you have non-slip mats in the bathtubs and in the showers. Other things that can be done to making the home safe include making sure that you wear good shoes inside and outside of the home. Shoes are very important. If you have problems with falls or poor balance, you really should not be walking around the house without appropriate footwear. You want to make sure that you have shoes with firm soles and a non-skid backing. You want to avoid your comfortable shoes, like your slippers or your flip-flops, and definitely avoid high heels, especially if they have a heel more than 1 inch in length. In fact, if you have shoes that have higher heels on them, that actually will increase your risk of having fall problems. Another way that you can reduce your risk for falls is to make sure that your most used items are within easy reach. If there's a particular spice or herb, let's say for example, that you use a lot for cooking, don't put it on the tallest shelf that you have to really reach up and grab for, that you have to pull out your stool for. Make sure it's within easy reach. Don't put yourself at risk. Another thing that you can do to make your home safe is make sure not to rush. There is no need to rush within your own home. If someone is knocking at the door and you're not expecting someone, it's probably a salesperson. If you are expecting someone, they can wait. If the phone is ringing, same thing, don't rush. If you really need, if that person on the phone really needs to reach you, they will either leave a message or they'll try back. You really don't want to take the risk of injuring yourself, breaking a hip, for example, to try to rush to a phone or the knocking door if it's just someone trying to sell you something, like a magazine subscription. Another thing that's important is make sure that you use assisted devices if instructed. If a medical professional, such as your physician or a therapist, has recommended that you use an assisted device such as a cane or a walker, please use it. There's a reason why these devices are recommended, and that is because they are there to help with your gait and to help reduce your fall risk. I have seen patients be given prescriptions for very nice walkers, and they basically use it at their home for fancy coat racks. The reason why, again, that they're given to you is it's to help you. So If you've been advised to use an assisted device, such as a cane or walker, make sure to use it. If you have trouble with balance or falling, make sure that you have grab bars in the shower or the tub and also next to the toilet. That will also help give you support in the bathroom. And something that's also important is that you should just know the slippery spots outside your home. As I mentioned, quite a number of these falls happen in or near the home. And when it's near the home, I usually hear the story of someone that's falling outside when they're gardening because they keep on slipping at that same spot each time. Well, if you know that it's a spot that always gives you problems, go ahead and make sure to avoid it or to somehow block it off so that it won't contribute to your falls. What is also important in order to reduce your risk of falls or prevent falls is to talk to your doctor. If you fall, you need to tell your doctor. Your doctor won't know unless you tell them so. If at all possible, what may be helpful for your doctor when you want to share the fall with him or her is that after you fall, try to remember to write a short, detailed description about your fall, such as when it happened, where it happened, what symptoms did you have when it happened, so that you can share these details with your doctor. And remember, the reason why I'm recommending this is because a lot of individuals, usually within 3 months, forget that they fell at all. So if you're able to jot a note down to yourself about the fall, you're able to give more details to your doctor at a future visit. You also should review with your doctor if you're feeling more unsteady or falling more after starting a new medication or having an adjustment in the medication's dose. It could be due to the medication. You could be falling because of the change. And so the physician may decide that the benefits of the medication outweigh the risks of the falls it's increasing and may cut your dose back down. Or your physician may try to find an alternative that can help your medical condition, but that won't increase your risk for falling. Also, remember to discuss with your doctor if you notice a decline in your vision, or if you see your eye doctor annually. That will also capture to make sure that you aren't having any problems with your vision. And also share with your doctor if you or someone else has noted a decline in your hearing. What this slide really shows is it's really if you don't use it, you lose it. And what I mean by that is the following, is that if you remember earlier in this presentation that the second most common cause of falls after environmental hazards are due to walking or balance problems or weakness. And it is very important to remember that this decline is passive and actually starts at a very young age. Remember, like I said, this actually, your ability to have the best walking and balance really occur at around the age 20 and actually starts declining from that age. So this is a passive natural decline, and what one needs to know is that you need to actively work at slowing down or preventing this process. Sure, we know about exercise for strength, but we also need to remember that there needs to be continued activities in the areas of flexibility and balance in order to prevent decline. So we need to actively participate in strengthening to prevent weakness, flexibility to prevent rigidity, and balance to prevent imbalance. And if you don't work on these actively, then you lose it. So if you don't use it, you lose it. And in this case, if you have any deficits in any of these three items, that will increase your fall risk. I have some activities here today that I'd like to demonstrate today. Please remember that all these activities are best done if there is someone initially close by and readily available to help if you have problems. You can then work towards independently doing them once you feel comfortable. Also, please remember that these won't solve every falls related issues that you may have, but that these are general activities that may help. therapy for fall risk is best if you have something that is individualized for the issues that are causing you to fall. And I am ecstatic today to have Janet Redke, one of our physical therapists at the UC Davis Outpatient Therapy Clinic, and a volunteer, Doris Nelson, here today to help demonstrate just a couple of things that you can do in each of these areas to help decrease your fall risk.
Okay, Doris, I want you to put the TheraBand around your foot, and we're going to work on strengthening your big thigh muscle. So hold on to the TheraBand with either hand. Now bring your leg up with your knee bent. Try to keep your arms still and straighten out your knee. Push down with your foot. Good job. Up and down. Okay, one more time. Good. Okay, now we're going to go into doing the same thing only with your calf muscle. So hold your leg out straight and just up and down with your foot. Okay, go ahead and drop the TheraBand. I want you to scoot forward in the chair. We're going to work on stretching the back of your thigh muscles. Hold your leg out straight with your heel on the floor. Pull your toes up towards your face and keep your chin up and slowly stretch forward down your leg. And you're going to hold that stretch for a count of 10. Okay, back up. Again, pull your toes up. Good, you feel the stretch? Good. And one more time. Okay, very good. Okay, now I want you to stand up for me, and I'm going to show you another way to strengthen your thigh muscles in case you don't have the TheraBand. Come around behind the chair. Okay, and I'm going to put another chair behind you. And what I want you to do is I want you to do a shallow knee squat. That's it. And up. Just down and up. A little slower. Very good. Okay, now we're going to do some balance exercises. I'm going to turn the chair around that's behind you. And what I want you to do is put your hands crisscrossed across your chest. You're going to shift your weight forward on your toes just to the point where your tummy touches the chair in front of you, and then back until you feel your toes start to lift off the floor and you touch the chair behind you. There you go, just a sway forward and back. Nope, not quite so much with the bottom. Okay, now when you're comfortable, close your eyes and continue forward and back. Okay, very good. Now open your eyes. We're going to make it a little bigger. So I'm going to move the chairs further apart. You're going to have to reach the chair with your bottom by sticking your bottom out. Reach the chair behind you. Go ahead and touch the chair behind you. Now move your pelvis forward and touch the chair in front of you. Go ahead, forward and backward. Keep going. So this is a bigger sway, and you're using your hips to help with your sway. Now close your eyes. Very well done. Okay, we're going to do something similar, only instead of forward and backward, side to side. So I'm going to put a chair over here to your right. Keep your hands across your chest. And I just want you to shift your weight to the right until you touch the chair on the right. And then to the left. Try to keep your shoulders stiff. When you're comfortable, close your eyes. Okay, very well done. Okay, the last balance exercise I'm going to have you do, I'm going to have you move over to your left so I can put some pillows. You can put your arms down. I'm going to put some pillows behind this chair. Using the chair, I want you to stand on the pillows. Okay, let go of the chair. When you're ready, close your eyes. Okay, very well done.
Thank you, Janet and Doris, for your demonstrations. Remember, working on your strength, flexibility, and balance should be lifelong. So let's move on to the issue of, well, Dr. Lin, I've done all that's been asked of me. I've done the recommended therapy. I've seen all the specialists I'm supposed to see. I've had all my medications changed, and I'm still falling. Is there anything else that I can do? Well, there are potentially a couple things that can still be done. You could try on one of these, and you probably would be saying, Dr. Lin, I already wear underwear. Why do I need to wear this in order to stop from falling? What I wanted to direct you at is this thing on the side, over this person's left hip. This is called a hip protector. The padding in this piece of undergarment is usually constructed of foam or hard plastic, so that if you fall, the padding will either absorb the energy of the impact or distribute it to the surrounding tissue. This in turn should decrease your risk of having a hip fracture if you fall. Now, the thing that's a little challenging about the hip protectors are the following, is that there's still quite a bit of medical debate as to whether or not these actually decrease your risk of having a hip fracture if you fall. And I think one of the major reasons why this is the case is because I have quite a number of patients with good intentions buy this and they never use it. Okay, so as you can see, this basically only works if you wear it. They don't work if it's sitting on your bed or sitting in your dresser drawer. So before buying one, you should really discuss with your physician about whether or not this may be right for you. Or realistically think to yourself, is this something that I could wear regularly and correctly every day? And also, can you take it on and off with ease? Because you will need to take this on and off throughout the day if you have to go to the bathroom. Another device to consider is a small alerting system. You may have seen this before on television. Remember what I said that one of your bad outcomes that can happen from a fall is being found down on the ground because you were unable to get up and you were on the floor for hours. What this little device does is that once you've fallen down and you push the button, it alerts your local emergency services to let them know that you can't get up and that you need help. So the firemen or your paramedics will come out, help you up, evaluate you, and see whether or not you need to seek further medical care or intervention. The primary reason why my patients don't get this regularly is because of the cost. There is a monthly subscription fee to this service, and it can range anywhere from $15 to $50 a month for service. So it is helpful, but not cheap. So let's review the questions that I had posed to you at the beginning and kind of think about what the answers are. So what is the answer to the question, who falls and why do physicians worry? Remember that falls are very common. You are not alone, and that everyone falls. But we are very worried about falls in patients over 65 because these can lead to significant injury and increase the risk of death or disability. What increases the risk for falls? The answer to that question, again, is that there are many internal as well as external factors that will increase your risk for falls. The major ones are your environment, whether or not you have weakness, specifically of your lower extremities, or if you have poor balance. And these are all important risk factors for falls. Number 3, what might your physician do to investigate your falls? Your physician will take a history, physical exam, will check a special blood pressure test called the orthostatic hypotension blood pressure test. Your physician may also refer you to a physical therapist for further evaluation or may change your medication. But one thing that has been shown to be helpful for the physician to better understand about why you may be falling is for your doctor to do a timed get up and go test. And this should be one of the tools that should be used in evaluations of your falls. So if you go to your physician complaining of falls, please ask him or her to conduct this test with you. And lastly, other actions that you can take to reduce falls. There are many things that you can do to decrease your risk of falls. Those include making your home safer. Those include making sure that if you don't use it, you lose it. And that you need to make sure that lifelong you need to continue to work on your strength, your flexibility, and your balance. That your doctor won't know you have a problem with falling unless you share that with him or her. And that if you still have problems with falling despite all the interventions and recommendations that have been done, then consider getting a hip protector or an alerting system. I'd like to thank you very much for listening to this talk.